Thank you for watching the Whittemore Community Magazine live on Facebook. You can watch a rebroadcast of this episode by visiting WCM Live on YouTube.
We're back. You're live. You're listening to Whittemore Community Magazine live right here on Facebook, YouTube, and our network, WCMagazine.net. I'm your co-host, Ed McQueen. Our sister April is still on a well-deserved hiatus. She's been working hard, and Doc, you know that she's been working hard with you on the network and other things in the community. So she's really sought after in the community. So we're going to we're going to get a grip on something that has been it should be bothering us a whole lot. And we all saw the promotion about the Supreme Court's decision on Obamacare. It should be bothering us, all of us, a lot, because it's going to have an impact on on just about all of us, especially in our community, and any community with moderate income and sometimes higher income. Okay, that the statute itself is very, very critical to people, based on their income. So today, I'd like to you all to just take a breather and let you all know that we have three guests with us today that is going to expound on this issue of Obamacare and its interaction with the virus, because the virus will cause you to get sick, and then you're going to need insurance, preferably by using Obamacare as it exists today, in order to get not just shots, because we don't know if these vaccines are going to be free or not. Okay, so but anyway, our guest today, I'll start from the bottom of Mr. Samuel Rue, who is a retired insurance executive. He's been on our frequent radio program in the past, talking about Obamacare and the impacts, and we're going to get back to Brother Sam Rue later on. Of course, next we have Dr. McIver, who everybody knows, I'm sure. If you haven't seen him on this program, you'll see him on the network, which is a constant. He's a regular there, and of course, with our co-host April, runs that, and of course, she's doing a fantastic job highlighting and updating everybody on this virus. And boy, do we need updating. I mean, every day this thing is changing. It doesn't seem to be getting any better. And next, Brother Lee Moultrie, who's coming with us today. I mean, he's from Charleston, but he's coming with us, and we would like to start him off by he sent out an email earlier to a number of people about the recent decision by the Horry County Council. And Brother Lee, you can correct me if I'm wrong, regarding their proposal to have to allow mining. That's right, mining in neighborhoods. I don't know what restrictions are with the neighborhoods, but we're going to start with you, Brother Lee. If you can, before we get on the Obamacare issue, can you just give us a rundown of the criticality of this, okay?
Okay, brothers, listening audience, County Council, Horry County Council is meeting tomorrow night, 6 o'clock. You have till 3 o'clock tomorrow afternoon to email them or call them and say you want to have something to say with respect to mining, M-I-N-I-N-G, mining anywhere in Horry County. This is the second reading tomorrow night. The county council needs to hear from you. If they don't hear from you, they're going to think it's okay to be mining in your community, these business owners. It's on the bill to loosen restrictions in your community. And it doesn't care where you at in Horry County. I don't care whether you're in a $300,000 house or a $30,000 house. They're saying Horry County. To me, this is the most important thing that anyone should be even thinking about, because this impacts your quality of life. And we don't need to come back later on and say, well, we didn't know that this was happening. Or how did this get by us? You have till 3 o'clock tomorrow to call these people up. Call your county council representative. Call your city council representatives up and let them know you disapprove of this. This is important. This is for your children, your grandchildren. Has to be done. Go to your county council website, find this information, or you can go on the Whitmore Horry County Community Facebook page and you'll find the posting. Or you can come to my page, Lee Moultrie on Facebook, and I have the telephone numbers for you and everything. I am a civil rights activist. I'm a social justice activist. I retired from the Air Force 26 years ago. We who are saying that we are here to take care of our children, our community, this is it. We have no reason not to be at that county council meeting tomorrow, raising pure D hell. This ain't about no churchness, because they don't let you know that they coming to put a mining in your community. Again, this is the second reading. And I just happened to see it this morning. I'm reading the morning newspaper, and I immediately sent an text Edward. So I've been doing this stuff here now for the past 20 years between the Medical University of South Carolina and the University of South Carolina, dealing with healthcare, ObamaCare, Affordable Care Act, all of this stuff. So people, I am a straight up brother from the hood, 64 years old. So don't get me confused. This is real deal. And we have to talk real to each other. We can't go around being no victim to nobody. We got the information. We need to get real and say, we're going to be calling these people tomorrow morning, if not tonight. I don't know why not. All you have to do is call your elected official on their official telephone numbers, email them with their official email numbers, and county council. But I'm here to listen what the other brothers talk about the Affordable Care Act. I want to support them in what they're going to be discussing. I used to be an insurance agent many years ago. I understand the Affordable Care. What we have to make sure a lot of people don't understand. So I'm here to support these brothers and what they're going to share with you tonight. And I'm also here to answer any other questions might come up about this issue. And that's all I have, my brothers. Thank you for the time, Brother Edward.
Yes, sir. Yes, sir. Yes, sir. That was very important. I thought it was, critical to bring this out first, so that people have something to digest, while we're listening. Because pretty soon you're going to realize this is all related, even with Obamacare and with the COVID. All of that is related, because who knows what the impact of this mining is going to be on our health in our areas. Okay, so Brother Sam.
Yes.
Yeah, there were a number of concerns. I think you, among others, submitted to us that you thought would be pertinent to the listeners here today, and one was the disproportionate impact of the virus on the uninsured. You want to elaborate a little bit on that?
Well, first of all, let me thank you for having me, and thank you and April and all the great job that you're doing with this. And I want to thank Lee for those comments and the doctor here also. Yeah, I just feel like, we talked about the Affordable Care Act. It was probably about 2010, I believe we had the health summit at Cherry Hill,
Yeah,
and it's still having an impact. And so when I look at now, the disproportionate share of Black and brown people that are dying from this pandemic, and we're in the middle of a pandemic, and then the nerve that someone will take this to the Supreme Court to try to uh, get rid of this, distinguish the entire Affordable Care Act, to repeal the act. This is a big deal, and people really need to wake up. And in South Carolina, you got over 500,000 uninsured. And if we look back to the Affordable Care Act, one of the provisions was that the expansion of Medicaid. And that would have picked up a lot of those folks. There are 12 states that didn't expand Medicaid, and South Carolina is one of them. North Carolina is another, Georgia, Alabama, Mississippi, and on and on and on. Even Virginia, we expanded Medicaid. So this law has provided health insurance for about 20 million people in the United States. And so if this law would be repealed by the Supreme Court, and the indications now that may not happen, but we don't know for sure, then those folks will lose their health care. And the whole issue is around Medicaid expansion was a big part of the law because that was supposed to pick up about 30 million uninsured individuals. But the other piece that was missing was the individual mandate. And insurance works like this, is that you have a pool of individuals in the insurance pool. Some are very healthy. Some may be younger and not so and healthy. Some may be baby boomers like we are. And so you need that pool in order to get the cost down. And the individual mandate said that you had to have insurance. Of course, you could be on your parents' policy to the age of 26 if you were in school, but you had to have insurance or else there was a penalty. If you remember on your tax return, they would ask you about your health care. Well, what Congress did in 2017, they made the penalty zero. So essentially what they did was eliminate the individual mandate because there was no penalty. So if I'm a 25-year-old or 27-year-old and healthy and doing well and working, I might decide not to buy health insurance because I feel like I don't need it. I'm strong, I'm healthy. Why am I going to spend the money? I can go buy something else. And so this law is in the Supreme Court now. And the fight is about, since Congress zeroed out the individual mandate, then the Affordable Care Act is not constitutional. We don't need it anymore. However, strange things happen. There's the indication is it may not be, but we don't know for sure because that's going to take some of the conservatives like Kavanaugh or some of the others to be a part of it with the more liberal type justices. So not having Obamacare, not being able to expand Medicaid in a lot of places, there are a lot of uninsured people, and a lot of those people are black and brown people. And then what the Affordable Care Act did, it provided things like preventive care. So what you were talking about, taking shots, and the doctor knows all about this, that these things are covered. They even expanded some of Medicaid. So the issue is that this is a big deal, and we got to be careful who we elect and send to Congress. Now, why in the world South Carolina can't reach down and gather all those people because somebody doesn't care? And that is the big deal. And that's a pending problem. We got to get out and vote. And like Brother Lee said, we got to be vocal. We got to stand up. We got to talk about this, and we got to educate ourselves. So this is very, very important, and it's a crucial thing that's going to be decided soon in the United States Supreme Court. And I'll let somebody else talk, but I tell you what this also does too. This drives up the cost of health care. When I worked for an insurance company for 37 years, I negotiated contracts. And here's what would happen. An uninsured person, in all likelihood, they're not going to go and visit Dr. McIver or a physician. They don't have money. They're trying to survive. And so they try to do home remedies, or they wait till it gets really bad and they go to the emergency room, which is not a cost-effective place to go. They're for traumas and accidents and all kind of heart attacks and those type things. So it risks it get really bad. And what might happen is somebody catch something late, and that can be real costly. And who do you think pays for that? Those of us who have insurance and got to pay. The hospitals and the doctors, the insurance companies have to pay for that, and they rate that back to you individually. So kind of a long story on that, but I just wanted to share that perspective from there.
Well, it's not long enough because we're going to come back to you with some,
Okay.
some things of concern, you know,
Yeah.
that was sent to us. So Dr. McIver, do we see an immediate? We think we're going to see an immediate impact on the decision if the decision is to eliminate the ObamaCare or the Affordable Care Act, in terms of your patients having access to you.
Yeah, I'm not. I mean, there's talk about it being repealed. I'm just not sure that's going to happen. I'm concerned, but I'm not convinced it's going to happen. However, it's important to make sure that we stay on guard to guard.
Yeah.
Let me say this. Back in March of 2010 was when the ACA, or as we call it, Obamacare, went into effect. It really had three primary goals. Number one was to make healthcare insurance affordable for more people. Number two, to expand Medicaid statewide. And number three, to create innovative medical care delivery systems, primarily in primary care. And I'll get to that in a second. But what happened was, like I said, that was established in March of 2010. But what happened was in 2012, the Supreme Court came back and said all states did not have to participate. Mm-hmm. So when that happened, at the time, it created 14 states, including South Carolina, that did not expand Medicaid. Now, here's some truths behind that. Right now, historically, the government covered about 70% of all Medicaid costs in the state. Had South Carolina expanded Medicaid, it would have gone up to 10 to 90% of care. So it would have gone from 70 to 90%, but the states would have been responsible for covering the 10%. Now, the politicians that were in charge at that time, Governor Haley, felt like 10% was too much and that the state couldn't afford that. That was the rationale that they gave. However, those of us in the medical community felt like this was more of a political move, because shortly thereafter, she was head of UN, and there were some things that were there that happened to benefit. But again, what happened was right now in the US, there's about 28 million people that are uninsured. As the brother said earlier, over 520,000 in South Carolina uninsured. So expanding Medicaid would have helped, over 100,000 adults get on the Medicaid. It would have generated over $11 billion for South Carolina between 2014 and 2020. And over the next decade, it would have generated about $15 billion for the state. Now, here's the irony behind all of this. The federal taxes that we pay in South Carolina actually go to states that did expand Medicaid. We're paying taxes to help other states cover their expansion of Medicaid.
Right. As a result of the action by our politicians.
Right. So part of our federal tax dollars are going into the pot to pay for those states that did expand Medicaid in their state. So, there's so much irony to that. It has become a political item. Like I say all the time, when healthcare becomes a political issue, people die. Because you're having people make decisions that have the best healthcare. You have people that are making decisions on healthcare that they don't have those issues. They don't have those problems because they got good healthcare. So the concern is that it's created a huge imbalance prior to the Affordable Care Act. It's created a huge imbalance of the have and have nots.
Yeah.
And part of the issue, which is not really talked about, is that there's so many provisions in the Affordable Care Act to help target primary care, because primary care really is the undergirding of the health care system. And if primary care is not strong, there will be major problems in that particular place, whether you're talking about local, state, regional, or national. In places where there's a shortage of primary care, people often get sick more often and often die more frequently. So that's an issue coming from my standpoint. And one of the reasons why I went into help primary care was to be on the ground helping those in my community.
Okay.
Well, my question, brother, would be, how do we educate the constituents of what you just shared so they can be advocating with their elected official to make sure that this disparity don't continue?
Well, it's a local and state thing, because again, it's the individual states that are mandating the lack of expansion. That gets back to the governor.
Yeah.
That gets back to the governor.
But what I'm saying is, how do we educate the constituent, being the consumer, the individual in our communities and states? How do we, in the medical community, you and your other doctors, the medical society, what are you doing to educate the community that they need to be advocating more so with the elected official to do things a little differently?
We want to get the governors and get the people out of there that's in there.
Yeah.
I mean, that's the bottom line.
Yeah.
That's the bottom line.
Yeah.
The bottom line is you get the people out of there who are making these decisions not to do it.
Yeah.
That's the bottom line. It's no magic. It's no magic pill. It's no magic bullet. It's the people that's doing the roadblocking need to go.
And that's sort of what we did in Virginia. I mean, we talked about it in our churches, fraternities, sororities. Right. We hit the ground,
right?
And we were able to get the delegate in there that believed in what we were doing. We hit it from there, and then we were able to elect the governor, and he's a physician. Understand the issues. We had him come to our meetings. So it's grassroots. You got to start at the bottom, and you got to elect people.
Right.
You know, we keep sending folks. And we just elected in South Carolina, and they care nothing about this.
Right.
Yeah.
So you've got to get out. You got to educate the folks, and we did this in 2010. But you need more follow up because it's not an easy issue. But you really got to push it and get the right people in there, because they were in Virginia was like, we can't do this because of all the dollars and everything, and the governor got it done.
Right.
It was a process, but we got it done, and we got to keep talking about it. Otherwise, like Doc said, a lot of folks are going to die, or they're not going to get help, or it'll be people that we know.
Well, the thing that you're talking about is, and I spoke with Edward and the other group. We met last Monday.
Mm-hmm.
We're developing a coalition. How do we form coalitions, community action groups in each community?
Yeah.
So with the expertise that the two of you bring to the table, we need that for people to understand why they need to be potentially voting a little differently for their best interests.
Yes, absolutely.
That's true.
That's true. I think you're starting at the right place, because I mean, it's otherwise it's going to stay the same.
Right.
Because, yeah, and the platform that Edward and April have, and the trust that they have with the community, I think that's what we need to be doing a little bit more of, and especially with this mining thing also. We have to do this and show people genuinely the okie doke that's being played on them.
Yeah, absolutely.
Doc, was Virginia one of those states that decided? And I probably should have been asking
for affordable care.
Yeah, we
expanded, right? Yeah.
Their governor is very proactive. As Brother Roos said, he is a physician, and so a lot of decisions that were made regarding, let's say in this instance, COVID, were based off of the fact that he is a physician and he understands epidemiology, he understands biostatistics, and he understands the fact that that these things needed to take place. I mean, you know, they're not, for example, they're not playing any high school sports in Virginia.
No.
You know, and that was early on. And Virginia was, in a lot of cases, able to help prevent these really massive increases in these COVID numbers.
How long, Doc, how long you been here in South Carolina practicing?
I'm from South Carolina. I've been back. I've been a physician in South Carolina. I came back in 97 when I was in residency in 97.
So did you remember Dr. Lovelace that was running for office?
I knew Richard Lovelace well. As a matter of fact, his office in what town was it?
I can't think of. It starts with a.
His office was up in I actually spent 2 months in his office. What's the name of the little town?
Was it Easley or Eastover?
No, not Eastover. It was kind of between Columbia and Newberry.
Edgefield.
No. But
we know what we're talking about. Yeah.
Right. Yeah. I know Richard. I know him well. Oscar Lovelace.
And so that's when we were trying to get a couple of years ago, get him to be the governor.
Right. Yeah, he trained in the same place I trained. And so he actually has students that it's in Newberry. Newberry. And so his office was a satellite office to go there. So I went to Newberry, worked in his office, delivered babies, and saw people in his office.
Okay.
When I was in residency.
So we just need to do that. We just need to bring the right folks to the table.
Right.
Since this election, this is a game changer for us.
Right. And
we starting over. How do we build, as Biden and Harris say, build back better?
Mm-hmm.
Yeah.
Well, as Brother Roos said, I think as we all believe, it's a grassroots thing. And you know, again, it's so many different layers to this. It's so many different layers. And again, it all kind of centers around Republican and Democrat.
Yeah.
And so even for as all the things that President Trump said and did, people still voted for him because they still were looking along partisan lines instead of looking at what was actually happening. Healthcare is really at the forefront because, again, you want to find a healthy, thriving area. You want to see a healthy, thriving medical community.
Yeah.
One of the least talked about provisions in the Affordable Care Act was how it directly targets primary care. And there were some specific guided things in the Affordable Care Act that dealt with primary care. And some of it included, you know, trying to get more resident physicians interested and medical students interested in primary care. Mm-hmm. Because prior to the ACA passing, there were some studies that were done that showed that half adults in the United States reported issues getting into primary care visits. And that's because of availability. 2/3 said that they had issues coordinating care between a primary care doc and a specialist. About 1/4 of ER visits, now this stuff kind of helped bolster Affordable Care passing, but about 25% or 1/4 of ER visits could have been avoided by simply being able to have access to a primary care office. And about 50% of those people that went to the ER said that they would have much preferred going to their primary care office to be seen. So we know there's a shortage of primary care physicians. We know that's a given. And so what happens is that just trying to get more people interested in primary care. About 50% of primary care offices have less than 2 providers in them. So about 1/3 of all primary care offices are solo practitioners, and then about another 15 to 16% have 2 physicians. So that puts a huge strain on the physician. It puts a huge strain on the healthcare system, and a lot of those physicians just aren't able to see the patients like they need to keep them out of the ERs and the hospitals.
So Doc, during this pandemic, what do you think? How do you think it's going to impact any decision on Obamacare?
Well,
because we're talking about massive vaccines, and they'll probably, no doubt, be free, but at the same time, you know, there may be cases where you need more than a vaccine or something, and you know, who knows what the side effects are going to be. So
the issue is a couple fold. Number one, it appears that this vaccine, numbers wise, appears to be effective. It still have more work to do on it, but it appears to be the most effective that's been produced so far. But a number of roadblocks are going to be there. Number one, the trust to get the vaccine. Number two, you know, is it going to be as effective, you know, in the masses of people like it's being shown in the limited number of people? Number two, this is a virus like any other virus that will mutate and will change. So again, we're coming up with the virus now, but is this vaccine going to be as effective a year from now or 2 years from now as it is right now? Every year, viruses make a minor change, which is called a drift. Every 10 years, it makes a major change called a shift. And every 100 years, it makes a super change, which we call a pandemic. So that's the reason why people have to, you know, are supposed to get flu shots every year, because the virus changes every year.
Is it stronger or
it just
changes? It just changes. So we don't know the magnitude.
The genetic makeup of it changes.
Okay.
Well, you know, also the earlier part of this, you know, I wrote a letter to the editor down here in the Post-Inquirer, the newspaper, because you remember when they first were saying that it was racist, the disease was racist, and I was like, how can a disease be racist? That would mean, like I'm saying, well, if everybody in the medical arena is racist, then I would be saying Dr. MacGyver is racist. And I said, there's no way possible. So when we look at the disease, the virus, what is one of the things that keeps coming up? What is the comorbidity, underlying health condition? We're saying that it's diabetes, hypertension, obesity, and a number of other things. So as we are working toward that, and then another thing, I think, I don't know, Doc, if my memory holds me right, is more men being diagnosed with it than women.
Well, you know, it's a few more men than women, but I still think it's not like a major statistical difference.
Okay.
So here's what happens. A lot of times, you know, it seemed like it was disproportionately affecting us because we were the ones that were showing up in the emergency rooms because we were primarily and underinsured. Mm-hmm. Whereas other folks had insurance and they were able to go to their doctors to be seen. So a lot of the doctors were diagnosing it as just a viral illness in their offices because at the time we didn't know what COVID was. So people are coming to me saying, you know, Doc, you know, I came back to see you in January or came back to see you in December. Could it have been COVID? And I said, yeah, it very well could have been. We just didn't know that COVID existed. And we didn't have tests to see if it was COVID. Whereas a lot of folks started showing up in emergency rooms, folks of color, because that's where when people aren't insured, they tend to use the ER as their primary care office. So then they started seeing all these people showing up with pneumonia and this viral illness that wasn't having a particular pattern, but they knew that it was a viral type infection just from the blood work. So that's when these things started putting one and one together.
Okay.
Okay.
Let me say one thing, and Lee, you hit on a good point too, is that, you know, even though we want to have folks to get insurance, one of the things we got to work on is the healthy lifestyle.
Right.
That's it.
Really got to focus on that. And Doc, you know that a lot of things can be avoided. You may get a virus, but the underlying health condition, diabetes, high blood pressure, all these kinds of things that we really need to also, in conjunction with trying to change some of these other things, you got to work on that and kind of work that into the lifestyle. Eating
right. And that gets back to the primary care.
Yes.
Because if these things, and they realize that in the Affordable Care Act.
Yeah.
So that's the reason why so much emphasis was put on primary care in looking at this, because again, they realized that the gap there was in the primary care. So again, in places where there's what we call medical deserts, where people there's 14 counties in South Carolina that doesn't even have a hospital.
Yeah.
So those people are going 30 miles, 30 minutes away to get adequate health care in a lot of cases. So again, it's hard for them to do that a lot of times.
Well, but Doc, as Sam and I are saying, we understand the lack of medical facility.
Right.
Okay, but that doesn't stop me for doing some walking exercise for about 30 minutes a day.
Right, but it still gets back to the medical issue. You're right, because even if you don't walk, you still got to go to your doctor to get your blood pressure medicine. So all that play. I hear you, Brother Mutri. All that plays into the fact here, but it's still, the fact remains is that they still got to go to the physician to be seen.
Oh no, we didn't take that.
Right. What you're saying, that's a given. That we're not even talking about that part of it.
No, that's not a given.
No. It is a given that folks need to exercise. It is a given that folks need to do what they need to do. That's a given.
We need
hold on. I'm not saying that they're doing it. I'm saying it's a given that they need to do it.
Need to do it.
Yeah. Okay.
So I'm not even talking about that. Because we know we don't need to be smoking, but we still smoke. So I'm talking about going to the doctor if you've got diabetes to get your diabetes under control. I'm talking about going to get your blood pressure medicine and making sure that those blood pressure medicines are refilled. I'm talking about taking your cholesterol medicine. I'm talking about taking your asthma medicine. So we understand that the exercise, you need to be doing that. That's a given. That it needs to be done. Now, whether it's being done or not, that's a different thing. And that's a part of the conversation that the primary care doctors have with the patients.
Okay. Just let me just break here for about a minute or two. I want to do some commercials, okay? But when we come back, we just want to continue on that. I want to address the question, especially you, Doc, probably that, what can we tell our audience to look out for this pending decision with Obamacare, because I'm sure it's going to impact a lot of us one way or the other. Okay, so let's just shoot some commercials first. Okay.
Having problems with your vehicle? For quick, prompt, and courteous service, call Snag and Drag Towing. Gregory Graham will make sure that you're taken care of right away. 843-997-0751. That's Snag and Drag Towing Service at 843-997-0751. If you're looking for flowers for any occasion, the Daisy Fair Flowers is here to help you. They offer an enormous selection of flowers, gift baskets, and live plants for delivery in Conway, South Carolina. Serving Conway since 1980, the Daisy Fair Flowers, 1400 4th Avenue in Conway, or call 843-248-7222. You may also visit the web at thedaisyfairflowers.com. Looking for a full-service funeral home with a broad array of services? Look no further than McKeever Funeral Home at 1408 Racepath Avenue in Conway, South Carolina. They offer a wide variety of services, including traditional funerals, memorial services, and graveside ceremonies. You can reach them anytime, day or night, at 843-248-2706. That's 248-2706. McKeever Funeral Home in Conway, South Carolina. George L. Williams Jr. is CEO and licensed funeral director. Support the party that supports you. Vote for your own interests and those of your community. The choice is clear. Horry County Democratic Party. Take a stand. Register to vote 2020. This advertisement is paid for by the Horry County Democratic Party. For all of your insurance needs, home, auto, and life, see how it feels to be on a #1 team with Tony McAfee of State Farm Insurance. Call Tony at 843-903-7800 or visit him at 3888 Renee Drive in Myrtle Beach. Like a good neighbor, State Farm is there. Looking to start a new career? Train to work in Myrtle Beach. Classes starting soon. Free to eligible participants. Short-term, 3 weeks or less in hospitality, culinary, electrical, plumbing, and more. At Horry Georgetown Technical College, there's more. Continuing education at 843-477-2020. Horry Georgetown Technical College, where there's more. Enjoy soul food the way your mama made it. You'll be surrounded by some of the best food in Horry County and affordable prices. Blue plate specials, senior plates, and more. Daily specials at Big Mike's Soul Food. Big Mike's Soul Food is located at 504 16th Avenue in Myrtle Beach. You can call your order in at 843-712-2048 or visit BigMikeSoulFood.net to find out about the latest specials. Big Mike's Soul Food. Soul food, the way your mama made it. Treating conditions from A to Z. Schedule an appointment today. Ask about acceptable insurance coverage at Waccamaw Primary Care, 660 Singleton Ridge Road, Conway, South Carolina. Dr. Winston D. McIver Jr., a trusted and reputable source in Horry County and beyond, has all you need for family practice and sports medicine. Call 843-234-4362 to schedule your appointment today. Waccamaw Primary Care, 660 Singleton Ridge Road, Suite A, Conway, South Carolina. 843-234-4362.
Well, speaking of that, this is the latest copy. All right. It had the famous doc on it.
Yeah, I want a hard copy.
Yes. Yeah, okay.
Yeah, you know, and let me say this, Brother Mutri, you're absolutely right in the sense that exercise is key. So you're absolutely right. Okay, I want to say that.
No, I'm not saying. No, what I'm saying, brother, is that for us to talk about it.
Right, you're absolutely right. You're absolutely right, and I think that, and you're absolutely right. And I think part of the issue as physicians is that we see so many people coming in after the fire has already started. Mm-hmm. So if we can try to get them to be seen by whatever physician they see early on, a lot of times we can put the fire out when it's just a flicker. But you're absolutely right. It's all interconnected. So you're absolutely right.
We don't even want them to have a fire.
Huh?
We don't even want them to have a fire.
Well, there's going to be some fires because a lot of this is not just exercise. A lot of this is genetic. And so a lot of these things, even I'll tell you, I'll give you an example. I had a very quote unquote healthy person see me today. She exercises regularly. Her cholesterol was fine. Her blood pressure was fine, but she just had a heart attack. And she couldn't understand, if I'm doing these things, why did I still have a heart attack? And I said, oh, we forgot about mom and daddy had a heart attack. Mm-hmm. So some of this stuff is genetic too. So you're right. Exercise is so important and so key. Without a doubt. That's
but educating, like you said.
Right. Go ahead.
But educating the community and being involved and having folks like Doc and Lee and actually getting out there, hitting the bottom line and telling people at an early age what needs to be done. I mean, I'm hoping and I believe that this thing will not be repealed. But regardless, we got to work on ourselves, our own health. And we got to figure out in the community, how do we get to them? You know, what do we got to do to get people stirred up, to get people start looking at the elected officials and bringing these items up. If nobody bringing up to guys that going to DC or going to Columbia, you know, they just keep doing the same thing.
You're absolutely right.
It doesn't affect them.
You're absolutely right. What April and I had started doing, I think we've been 33 Fridays in a row, and it was primarily started to talk about COVID. But after we talked more and more, I said, April, it's got to be a little bit more than COVID. So we had the whole month of September and October where not only did we talk about COVID, but we talked about cancers. So we talked about breast cancer, colon cancer, lung cancer, prostate cancer. Each Friday, there was a different cancer that we talked about.
Outstanding.
Right. So that's one of the things, Brother Mutri, that we're trying to do on this end to try to help educate folks on that.
And for sure, that's going to be part of our projected broadcast.
Right.
That we're going to start talking about, especially prostate cancer, which is
right.
corralling Black men like it's going out of style.
Yes.
Right.
And I'm getting so much feedback from people on the streets want to know when we're going to have something on prostate. I guess it requires how I'm going to formulate it and to make sure that it's effective once we start talking about it on the broadcast. You know, how many people to bring on, who to bring on, and Doc, even though you're a primary, you're not the urologist, but you have. I'll go back to this word primary. You can primarily give us some.
Well, the truth of the matter is, right. The truth of the matter is more primary care doctors check PSAs than urologists.
Yeah.
The urologists just see the people when we find the problem.
Right.
So this really, and just same thing with breast cancer, colon cancer. Those things should be found in the primary care to make sure that bridge is bridge is there to get over the gap. But you're right. So it definitely is important. But we do it all the time. And our primary care, I mean, urology, urologists are very, I tell you I give an example, and this is related to colon cancer. One of my good friends, that's a GI doc in the area, came by to see me on Friday, and he just stopped by the office. And I thought it was kind of odd, but he just stopped by and he said, listen, I want to thank you for what you do. And I'm like, what are you talking about? He said, you just sent me a 50-year-old that had an aggressive cancer that had you not convinced him to have a colonoscopy, he probably would have died from colon cancer. So that is something that primary care, and I'm not taking credit for that because that's what I'm trained to do. That's what I do. That's what we should be doing. So it's not about me, but it's about the primary care doctors being the gatekeeper. And that's why it was so important that the Affordable Care Act realized that, to make provisions to talk about the primary care doctor. Because again, there's some times where we just have to, and that person, I had to stay on him about getting his colonoscopy. We're the same age. We went to school together. And the GI guy came out, it was Friday. He said, man, you saved that guy's life. He said, because he didn't want to have, even after I sent him there, he still didn't want to get the colonoscopy.
Wow.
And so, what
was the reason? Why did he give a reason?
Well,
macho.
Macho is part of it.
Yeah.
Something invasive going into the rectum colon. Sometimes the fact of people not wanting to know.
Yeah.
Sometimes people don't want to know. They feel like, well, I'm healthy, I'm feeling good. Sometimes a lot of times there's a cost that's associated with it because it's not a cheap procedure to do. But again, like I tell folks, these things are saving lives. When you're dead, it's not going to matter.
No.
When it's diagnosed at stage 4, that's already gone to your liver, it's not going to matter then. So primary care, and that was, like I said, part of the Affordable Care Act plan to do that. And they had specific targeted provisions to impact primary care. One of the provisions was that Medicare increased primary care reimbursement rates. Because there were a lot of physicians that wasn't going into primary care because they felt like they wasn't going to make any money. So that's a real thing. The other thing is Medicaid reimbursement increasing at different levels. Each of the different codes that we use as a diagnosis. The other thing is that, you know, it was 32 million people that were uninsured, and that leads to really uncompensated visits. So a lot of times, you know, if you're seeing the patient, you know, you're either seeing them for little to no reimbursement compared to if it were an insured patient.
So Doc, what a typical colonoscopy? I forgot what mine it costs. I get one there for 4 years, but what's the typical cost of one in this area?
Probably between $800 to $1,600.
Now, was that part of Obamacare? Was that covered?
It does cover preventive services.
Yeah, it expanded a lot of preventive care, even for people on Medicare.
Right.
So, yeah, it's very important. One point I want to bring up is that you talked about these testimonies where you got live examples of people in the community talking about, I had prostate cancer. And, you know, we need to encourage that. So many men, and I had this happen in my church. The guy's young fellow father, his father had prostate cancer, but he never told his son.
Right.
And then I wrote an article, I'm a cancer survivor, because I went to my primary care doc and he sent me to the urologist.
Right.
And I wrote an article about that in the church paper. And so many people came to me and said, you know, I'm glad you told me that because I never knew anything about this. Right. So when you can get individuals to like personally share their story, men and women, is very powerful.
Right. And I've got some people lined up that are prostate or cancer survivors in general, but specifically prostate cancer, that are willing to tell their stories and what they went through during the treatment. So we've got people like that. But other things that the Affordable Care Act did on primary care was it had scholarships, loan repayments for medical students and residents to go into primary care. And also they set aside $11 billion for federally qualified health centers, so that way they can give adequate health care to citizens in that area. Because a lot of those federally funded clinics are operating on shoestring budgets. And so they were just barely making ends meet in a lot of instances.
You know, I probably shouldn't say this, but it sounds to me like those opponents of Obamacare, given all of the content that you all named, Doc, what they provide, man, they just want you to die. You know,
well, again,
if you look at it,
they're voting on things that's not their problem. They're deciding things that's not their problem. They've got the best of healthcare insurance, so they're deciding on people's healthcare insurance that they don't have those issues.
Yeah, they can't recognize people like that. So we all of us probably know someone who does not have health insurance or in that situation, but they can't. And I'll tell you another thing that's happening. I know it's happening in South Carolina, all over the place. These large hospital corporations are buying up hospitals.
Yes.
You've got Grand Strand. We've got HCA up in Virginia. They got like 15 hospitals. They're publicly traded. They got tons of money. It can be a good thing in a way, but it can be other thing that kind of hurts the community. So the community hospital, and a lot of it has to do with uncompensated care, they can't survive.
Right.
Unless they connect with some larger facility, which can be good in a way.
Right.
But your community places is kind of dried up. Most hospitals are part of a big system.
Right. And in that article, Brother Rue, that Brother McQueen showed, I actually did a lot of research on that to come up with what I call the cost of COVID. Yeah. And basically hit the highlights on how COVID has really affected the healthcare system in the United States. And that was just basically a 4-month snapshot looking at that. That's not to say, you know, for the last quarter of this year, how it's going to affect it going into the first part of 2021, because we're still going to be talking about COVID-19 in 2022.
Yeah, one of the things Doc highlighted in this article is that, and I had it blown up, it says that the number of non-COVID-19 hospital admissions declined for conditions like heart attacks, strokes, urinary tract infections, pancreatitis, non-COVID-19 related pneumonia, altered mental status, diabetes,
Right.
and non-COVID-19 related respiratory issues.
Right.
Just to name a few.
What happened was, Brother McQueen, was that MUSC actually wrote a big article on the fact that the patient visits to their stroke unit had dropped off significantly compared to previous months, before COVID was an issue. And the problem was these people were staying at home having strokes.
Mm-hmm.
They didn't want to go to the hospital because they were afraid that they would catch COVID. The same thing with heart attacks. So a lot of these people that ended up dying at home, they ended up dying of heart attacks that a lot of times was likely COVID related, but these people were afraid to go to the hospitals.
Well, so Doc, I don't know what the latest statistics as of 12 noon today. Do you have a rundown on that in terms of the impacts of the COVID and the deaths and the number of
give me 1 second.
It was 11 million as of yesterday, and over 247,000 deaths.
Right. It's close to 250,000 deaths and
right
over 11 million.
Over 11 million people infected.
Right.
Wow. I might add, that's an increase from in one day of about 3,000.
Well, in the last 7 days, there's been over 1 million new cases in the last week. Okay,
and in most states, the positivity rate is going up.
Yeah,
in Virginia, we're like 6 point something.
Yeah,
in most of the states, the rates are going up. In some places, the double.
In South Carolina, it's about 13%.
So we're about 6.2 here. So you
right.
double.
I know some people are probably. I know you've heard about South Dakota and North Dakota. How there's committed. I know some people are saying, well, you should have had that bike rally up there, or whatever they had at that time. But I think we should take a different view and say, not just ignorance, but it was, and I guess it was just bound to happen, and but that should be a lesson, I believe, for the rest of the nation.
Well, if they're ready to learn.
Yeah, that's right. Yeah.
And so here's the thing: in the last 2 weeks, the number of COVID cases in the United States has gone up 81% in the last 2 weeks. In the last 2 weeks in the US, the deaths have gone up 39% in the US. And in the last 2 weeks, the hospitalizations have gone up 44%. That's in 2 week time period, 81% increase in cases, 39% increases in deaths, and 44% increase in hospitalizations. It's estimated that there'd be right now about 400,000 deaths by February the 1st.
Doc, I don't want to take anything away from what you are going to talk on this. I'm sure you're going to talk about the network on this coming Friday. It's going to be a status update. I start to say save some for that, but you don't have to do that, because by that time it's going to increase.
Oh yeah, I mean it's going to be up. I mean it'll be I mean this is a problem. It is a major problem. You had over 130 Secret Service agents at the White House that tested positive.
Yeah, right. Yeah, that's right. I know they're angry with what's his name.
Well, basically what you need to happen. Unfortunately, we got to wait that long, and because I keep trying to figure out why are these people getting it, and it's basically, I would imagine, them going to work.
Right.
And that's when the Defense Production Act will come in place, help people stay home, give the stimulus package, and people get paid that $650 to stay home and shut down, and makes it easier for the doc. Because I just heard on CBS News this morning, someone was being cared for in the hospital for COVID.
Yes, that's happening in South Dakota and North Dakota. They got a shortage.
No, listen to this now. Listen to this. The person was being cared for because of COVID, and the person was telling the doctor that they didn't believe in COVID.
Oh yeah.
That's
Oh yeah.
okay. Yeah.
Oh yeah.
Yeah. I've
Oh
heard
yeah.
that. I thought you were talking about. I think it was in South Dakota. There were nurses or someone were asymptomatic,
Right.
Yeah.
and they were caring for the patients.
Uh-huh.
The other thing has happened too. There are 11 million people unemployed.
Right.
So now your numbers are going to grow uninsured.
Right.
And so these people become ill, and where do they go? You know, they're going to try to survive.
I just heard the other day when you got two different pools for that.
Yeah.
Once they become unemployed, they're eligible for Obamacare. Also, that's where your federally funded clinics come in at.
Yeah.
Because of the federally funded clinics, you're going to pay based upon your income a sliding scale fee.
Exactly.
Because they can't afford all that big money that Dr. McGovern needs for commercials and being on the cover of magazines and stuff like that.
So, brother, it seems as though we got a platform here, and I think Ed, you and I, we talked about this before. That symposium where we start educating people. We got to start somewhere, and having this kind of expertise, and it affects all communities.
Yes,
and there's a lot of people that look like us that need help, but we want to help everybody, and there has to be a force to get this going, because the longer we wait, you know, we expect that the Biden and Harris campaign going to try to do a lot of different things. It's not going to be easy. We got to work with, but we got to start trying to do our part.
Well, I'm going to send you, Sam and Doc. I'm going to send you what I'm already in conversation with the state with right now.
Okay.
And setting up these coalitions. I think I sent it to you last week, right, Ed?
Yeah.
Okay, so I'll send it to these two brothers because it's about mobilizing the community, and that's all people, white, black, Hispanic, Asians, everybody coming together from ground zero, sitting down, talking to each other. Another thing, me throw this in, Doc. Years ago when I got diagnosed with hypertension, and I'm busting my butt in the gym, man. I'm kicking it down there at MUSC and so on and so forth. And I'm in shape, eating all the blueberries and everything there is. And the doc told me, he said, you know what, man? You need to thank your mama because you got that for life.
Yeah.
Right.
And so what we're saying is, as you're saying, genetics.
Yeah.
Something is genetic, but we have to also understand we need to be exercising, walking to start out with about 30 minutes a day, eating nutritionally as possible, adequate sleep, and drinking about half of your body in water. If we do those basic things like Sam is saying, we don't have, like Sam and all four of us are saying, we can start from there and move up to make sure to alleviate some of the pressure from genetics and also some of the other attributing factors we have in society.
Okay, Doc. I just want to read a couple of comments from our illustrious person that's on a hiatus. My sister April. I missed you. She asked the question, so what do people need to consider when it comes to the cost of medication, doctor's office visits, etc.?
What do they need to consider?
Right.
Well, I think the first thing the patient needs to do is if they don't have insurance, to talk with the physician to find out what their fee schedule is. There's some physicians that don't slide the fee scales, and they're like, this is my fees, whether you have insurance or not, this is what we pay, and this is what it is. You have physicians like myself that do slide the fees. Now, I have to be careful on how I slide them, because you can get in trouble for charging too much, too little, just as much as you can get in charge for charging not enough. It has to be in line with an actual standard of care. In other words, I got a call from Medicare back when I first started practicing. because they said you need to increase how much you're charging your self-pay patients. It can't be so much out of line with Medicare.
Mm-hmm.
So there's some physicians don't slide them at all. They're like, this is my rate, whether you have insurance or not, and this is what it is. Again, I slide mine to help those patients out who don't have insurance.
Okay,
Labs for patients at a reasonable price if they don't have insurance also.
okay. The other thing that she also asked was, what about people with pre-existing conditions?
Well, the thing about the pre-existing is that the Affordable Care Act, still kicked in whether you had pre-existing issues or not. Some of these insurance companies don't want people with pre-existing issues because they're considered to be a more risky insured patient.
So what do? I mean,
well, without Affordable Care Act, they don't have insurance, so they have to pay higher premiums if they can get insured.
They price them out of the market. It's about
right, exactly.
Most of the insurance companies. I work for Blue Cross Blue Shield in Virginia. They went public. Right. All right, so they're publicly traded company. It's called Anthem Blue Cross Blue Shield. Mm-hmm. Stock's probably trading $300 a share.
Right.
And then I work for Cigna, another publicly traded company. So it's about making money.
Oh yeah.
And so they price you out of the market. You got a pre-existing condition. We don't really want to insure you because chances are you're going to have something that's going to cost a lot of money.
You're too risky.
The premium's so high that you can't afford it.
You're too risky. We're going to lose money.
Risk. Right.
At the end of the year, when they get ready to divvy up the stocks, they're not going to have as much money left over if they insure a bunch of sick folks.
They're trying to protect their stock. I mean, and I'll give you an example. When the CEO, they took the insurance company, Blue Cross Blue Shield, public. All right, and then they finally were purchased by WellPoint and Anthem. Mm-hmm. So when the CEO left, he got $300 million in stock options.
That's right. That's right.
That's not unusual.
Right.
So it's about making money.
Right.
And avoiding hospital admissions because you got to go get medically necessary. They have a whole team of doctors. That's what they do, and nurses. And so it's about, you got to. Right, you may just die because they're not going to pay for certain things.
Right, and the other thing too, even getting admitted. There's something called intensity of service and severity of illness. If you don't meet those numbers, you may not get admitted. So back when I first started in medicine, as a early med student 30 years ago, if you had pneumonia, the odds are that you were going to be admitted to the hospital, right? Now, if your oxygen level is up, if you're not breathing fast and tachypnic and out of whack, if your labs don't look too bad, if you don't have a fever, you're probably going to be sent home with antibiotics to follow up with your primary care doctor.
And then the other thing they're doing is the hospitals are squeezing the patients, and the insurance companies are trying to pay less to the doctors, the primary care, because they got to negotiate.
Right.
They want to play less than sometimes not even cover the costs.
Right.
So there's a whole lot of issues that's why you got to get healthy. I mean, we want insurance, but people got to live a healthy lifestyle.
Right.
Yeah. So in other words, the blame is back on them, on the, for example, the poor person.
It's not a blame.
No.
It's not a blame. It's a responsibility.
Yeah. Right. Right. The responsibility is to take care of your health.
Yeah.
Be responsible for your health, but also make sure you follow up on getting checkups.
Yes.
And what happens is too, another thing with the Affordable Care Act and with a lot of these insurance, Medicare, is that they have these things now called annual wellness visits.
Yeah.
Where the physician, it's a free visit for the patient. And so what happens is you come in, you do assessments like mental health assessments, pain assessments, health maintenance, like are you up to date with your immunizations? Are we up to date with colonoscopies, mammograms, blood work, prostate checks, all those kind of things. And that's covered annually. And so again, that's something that we found some issues here. by just doing those wellness visits on patients.
Mm-hmm.
Wow. Yeah, Doc, I never knew that. Maybe it wasn't made plain to me that a wellness visit was free of charge.
Right. It's not a physical. It's a wellness visit. So it's almost like you take your car to Jiffy Lube and there are certain things that are checked off. Okay. And again, it's when it first came out, the wording was a wellness physical, but they had to go back and say it an annual wellness visit, an AWV.
Right.
And so that's something that, we're continuing to implement and make better here in the office. We had really started the process of cranking it out in the first part of the year, but then COVID came and we're primarily, 90% telemedicine right now here in the office still. But again, as that, changes, we'll get back to doing more of the wellness visits.
Okay, so for either Doc, you or rather Sam could address this. This comes from a commenter. That how will the impact of the Obamacare decision impact employment, insured people through employment? Will the premiums increase? The question was asked.
Well, the premiums are going to increase anyway.
Yeah.
So I mean, this thing about it causing the premiums to increase and this and that, they were increasing every year anyway.
Yeah,
but I'll let Brother Sam go ahead and elaborate on that.
Yeah. I mean, regardless, the premium is going to increase.
Right.
But I'll tell you this: the more uninsured you have, it's going to drive the cost up too.
Exactly.
Like Doc said, the uninsured not going to have the annual done, not going to go see a primary care because usually they can't pay, so they go to the hospital. And the hospital see them in the emergency room. Very costly. So what does that turn into? The insurance company may have to pay the hospital more. So then that rates right back to your premiums. And so that's what drives it up. So if we put 20 million more people uninsured, that's going to further help to move the cost of care up and premiums and insurance. So, we want this in place, but we want less people having to get care for things they can control by diet, exercise, and those kinds of things. Some things we understand that. But like Doc, diabetes or whatever, if you follow a strict diet and thing, you may be able to control that some.
Right. And need less medicines. And so you're right. It's all interconnected, all interrelated. And you both of you are exactly right on that. Exactly.
Early Charles Barkley, Van Jones, and the brother Don Lemon from CNN.
Mm-hmm.
And they did the thing called The Color of COVID.
Mm-hmm.
And Charles did an excellent discussion when he said, I had to make a conscious decision to start exercising more, eating a little differently. And he said, not drinking liquor during the week, but just on the weekend. That was the only stupid thing he said.
Okay, all right.
But he kept it real.
Okay.
But that's what we're saying. We're 4 black men that we have to be real with our people.
Yeah.
If we have to look at exercising a little bit more, saying walking exercises and changing, and then sleeping a little more or a little differently, and then not eating as much certain things. If we do have a weight problem, making sure we're talking with the doc and asking him, what does he recommend? Who do I need to be talking to? We just have to be honest with each other. We cannot be BSing each other all the time and blaming somebody else when we look in the mirror and say, what can I do differently?
Mm-hmm.
That's it.
Well, okay, man. It's still a lot more that you guys can talk about because as these things go up. But before we go, I mean, kind of going over time a little bit here. You got one commenter who said that, and this is from Ms. Beckman. She said, what can we do to not take so much medicine. She said. She says, she, for one, she doesn't like to take medicine.
It's basically what we said here. It's basically what we said here. Just, again, you want to try to treat your body like a temple. You want to try to exercise as much as you can, eat as healthy a diet as you can, watch those things that are bad for you. And we know these things that are bad for you. So I've got a thing that I've kind of do with my patients, and I've been saying this for a long time. I call it the rule of halves. So if I have people that come in and their A1C is up because their blood sugar is out of control, or if they come in because their LDL bad cholesterol is out of control, I talk to them about what I call the rule of halves. Half as much, half as often.
Mm-hmm.
And in the majority of cases, if they follow half as much, half as often doctrine, they'll make significant improvements in their lab numbers. Significant impacts.
Yeah, but it's so difficult, Doc, when all the food, just about 100% of the food that you buy has probably over a significant amount of sugar built into it, because the sugar comes in so many names, like maltodextrin, some called sorbitol, I guess, glucose, all that kind of.
But it's about choices. And again, we understand that sometimes finances and economics, you can go to McDonald's and get 3 burgers for the cost of a salad. So, again, you've got things like that are in play. But again, it's about decisions that we make. And people may not get this perfectly right. But again, if you can curb some of the things that you do, half as much, half as often, you can a lot of times make significant improvements.
Mm-hmm.
All right. Well, having said that, I want to thank our audience first. Thank you all for sharing this information with our audience. And we'd like, you want to send your comments, you can send them to Whittemore Magazine at gmail.com. But the information dispensed today to me is invaluable, and I'm so glad I got the three guests that we chose to put on there. It's just, to me, that it make all the difference in the world, and I certainly appreciate you so much, Brother Lee, all the way from Charleston down there.
North Charleston.
Sorry, North Charleston.
North Charleston. Okay.
They don't want this, Brother Sam. They don't want me in Charleston, man.
Okay, brother. I'll take your word on that. Yeah.
And of course, Dr. McIver, with our local primary care physician here.
Fantastic.
ObamaCare Primary Care over there on
Thank you.
660 Singleton Ridge.
Right.
Hospital. So he can ship you right there if you need me.
I'd like to thank Brother Rue. As always, it's always good to see my fraternity brother.
What's up, brother? Keep up the good work.
Right, I know, and I appreciate you. And Brother Moultrie, it's good to talk with you. I know you're doing some great things, and I've been following what you do too. So thank both of you all. Thank you. I appreciate it.
Thank you all for having us.
Yeah.
And thank you, Ed and April, for the opportunity. Sam and Doc, I will email you the document that I spoke about in a few minutes, and whenever y'all get a break, you can look at it. It's just for information.
Please do. Thank you, sir. I appreciate you.
All right,
brothers, and let's keep it going, and we can make a difference. We can't give up. We can make a difference.
Yes, sir.
This is a great start.
Yes.
But Sam, too bad you had to retire, man. You could have had some updated.
Getting some more. Brother, I'm on the other side now. I'm teaching martial arts science students. So I'm on the other end. They don't talk back to you.
Hey, Brother McQueen. He's still looking sharp though.
No, brother. Yeah, brother.
Brother Lou, and you too, Doc. But I started to show some video clip of 30 years ago with.
No, don't do that.
With your mom and dad.
Yeah, in DC. Yeah, I remember. Yeah.
Yeah. But I
need to take a look at those. Okay.
Yeah.
All right, brothers.
Yeah. Okay. So look, thank everyone. Thank our audience, and we'll see you next week, same time,
Keep it
right
up.
here.
Appreciate you.
God bless you, brother.
Appreciate you.
All right, God bless y'all. Take care,
God
brother.
bless y'all, brother.
See ya.
All right, take care. Bye-bye.
Thank you for watching the Whittemore Community Magazine live on Facebook. You can watch a rebroadcast of this episode by visiting WCM Live on YouTube.